Thank you.
Perfect. Yes, thank you, Whitney. I think you're right. It's really cool to be able to present in this way. I think we're all still on a bit of a learning curve, but it is amazing being able to either be at home, or in a group and then us obviously present to you. So what we'll do is I'll start with a bit of an introduction of myself, and then I'll get my wonderful colleague to introduce herself. And then we've got a bit of a presentation today on living well with arthritis. I had a meeting with Whitney yesterday, and we decided that we are going to do a little bit of an introduction to the top three conditions of arthritis in New Zealand. And if you guys have any questions or you're wanting to learn more about a specific type of arthritis, please let us know. We'll try to make time for questions at the end. But we would like to come back and do this again. So yeah, if there's anything specific you want to know about, please let us know. My name is Georgie, and I'm actually based in Taranaki, in South Taranaki. So if anybody knows Taranaki quite well, kind of comes out a little bit like that, and I'm right at the bottom. So about an hour from New Plymouth and about an hour from Wanganui. Fantastic. And what we'll do, for those of you that are online or in person, we've got a whole bunch of great resources. So we'll send. I actually have some in the mail on the way to Whitney, so they'll be there in the next couple of days. But we can also send you this presentation as well. So if you do miss anything or we go too fast, you can go through it by yourself in your own time.
Mhm.
But so yeah, I'm from Taranaki. I've worked at Arthritis New Zealand for about 6 years now. And my main role is working out in the community. And I also look after all the youth that have arthritis. So all the young people, all the children, teenagers, and young adults that are affected by arthritis. It's quite a uncommon condition, but we do have a cohort of about 1,000 children in New Zealand that have arthritis. And then, yeah, I do a lot of education workshops and teaching people about how to live well with arthritis, like what we're doing today. Sometimes in person and sometimes online like this. Tori, did you want to introduce yourself quickly?
Kia ora koutou. Thanks, Georgie. And thanks, Whitney, and the group, the wonderful group, for having us here today. So yes, my name's Tori. I'm based in Wellington at our national office. It's wet, it's raining, and it's windy, and it's disgusting. So I walked to work today and got absolutely soaked. I've been with Arthritis New Zealand for around, I was going to say 6 years too, but I think I'm a year ahead of you. So I'm 7 years. I manage our Arthritis Assist services, which I'll speak to you more on shortly. I also lead the development of our learning and development programs and resources. I also live with osteoarthritis myself, OA for short. So I guess this work is both professional and personal for me. Um, I'm a health coach as well, and it's something I care deeply about how we can manage our own arthritis or our own long-term condition and what we can do for ourselves in that self-management space. And that's around education, making things practical and meaningful for people. Thank you. Thank you for having me,
Elliot,
Georgie.
thank you.
Oh, I'm the backup in case Georgie freezes because she lives rurally. So I am the backup. So I'm going to be if Georgie, if you can just tell me when or I'll try and gauge when you're finished on each slide.
Yeah.
Hopefully this works.
Yeah, fantastic. Yeah, I've done a few presentations recently where everything was going really well and then I froze mid-presentation. So I'm very lucky that I've got Tori today that if that happens, she'll just pick up where I've left off and then I can reboot and come back in and join you. So if you want to flick to the next slide, Tori, we will talk a little bit about Arthritis New Zealand services. So Arthritis New Zealand is a charity. Some of you may remember fondly when we were the Arthritis Foundation. So we've been around for a really long time. We used to have little offices regionally throughout the country. And now we have our two head offices. So we do have a head office in Auckland and, as Tori said, in Wellington. And then we have people like myself working out in the community in different places around New Zealand. So, some of our main services that we offer, I should mention too that all of our services are free of charge. We don't have any services that cost any money, and we rely completely on donations and government grants, yeah, to keep helping people with arthritis. So, we have our online events, which this would be classed as an online event today, which is fantastic. We have local and online support groups. So local support groups would be very similar to the group that you guys belong to with Whitney leading in Auckland. And then we also have online support groups, and our online support groups are broken down into conditions. So if you have osteoarthritis, we have an osteo support group, we have a rheumatoid arthritis support group, we have a gout support group, and so on and so forth. And lots of people receive lots of kind of peer-to-peer support in that online space. Tools and resources. So we have a really brand new interactive website that is absolutely jam-packed full of all sorts of resources. So whether you are living with arthritis yourself and wanting to improve your lifestyle or learn more about your condition, or whether you maybe live with somebody that has arthritis and you want to learn ways to help, right through to health professionals that are working, every day with people that have conditions, people like physiotherapists or health coaches. Another part of our work is advocacy and research. So, particularly as we're coming into an election year this year, we try to really be on the forefront of advocacy and really collecting people's opinions and what they want to see within the health system is really important. And that goes alongside research as well. So, the research space with arthritis is actually quite exciting. We've seen some really amazing advancements in medicine and technology over the last 10 to 15 years, and yeah, some really exciting things. If we have time to talk about it, we could probably touch on it, but some of you may have seen there was a breakthrough earlier, late last year, around a gel that actually reproduces cartilage. So instead of doing a replacement in the future, we may be in a situation where we've discovered something that can actually reproduce something like cartilage, which is really amazing. Education sessions. So I do a lot of that at a community level, providing education for people to learn about their conditions. And then we have our wonderful, it says there, 0800 phone line and email. But if we go to the next slide, Tori, I think Tori could probably talk a little bit more about our Arthritis Assist team, which is
Here
a
we go.
fantastic service. Yeah.
So, Arthritis Assist is our national free telephone support service for people living with arthritis and related conditions. So, we'll talk a little bit about arthritis conditions, but we also talk to people about pain, um, fibromyalgia. If you've heard of fibromyalgia, it's not actually officially arthritis, but it's under our umbrella. So it's a non-clinical service that focuses on helping people understand their condition, build confidence, and navigate what support options are available in their region. Our service is delivered by it's a small multi sort of disciplinary team. We've got a couple of health coaches. We have a mental health support woman. She's wonderful. She's doing her master's in health psychology. So we find a lot of our calls, and when you're living with pain, have to do with mental health and that emotional support. We have a pharmacist, which is great because we always want to know about side effects and about our medication. And we also have a retired nurse. So people can talk through not just their symptoms, but their day-to-day realities of living with arthritis. And that might be questions about, like I said, medications, pain management, emotional well-being, or just feeling a little bit overwhelmed when that support, say, from their health provider, like their doctor, isn't there. And remember, our doctor, we only see them for 15 minutes. So sometimes we just need a little bit more time. Alongside our sort of that one-on-one support, we also run regular online webinars and podcasts that cover practical topics, share lived experience, and help. And we have all sorts of different speakers that come on. We've had orthopedic surgeons, we've had exercise physiologists, we've had, gosh, who else have we had, Georgie? We've had,
Yeah.
um,
Doctors, orthopedic surgeons, yeah,
yeah,
a lot of really,
rheumatologists.
yeah,
So it's, and we always, and they're on our, so if you go onto our website, you can go up to our events page. And actually, if you want to join up, we have an e-news, which then every month it's an email newsletter, and it will tell you what our events are coming up. So actually, we can probably let Whitney know how.
yeah,
I'll send Whitney. I'll send you the link, and people can just you can um, share it with your community. And we also have things like this. I don't know if you can see it. It's if we have two bit publications a year called Joint Support, and there's lots of different articles and all sorts of things and advice and tips in this. We have our resources. I don't know if you can see it. I'll probably show you, I have to go off share, but this is a really lovely exercise um, calendar, or not a calendar, a flip chart, and it's got exercises from your head to your toes. They're really gentle exercises, and we have them in hard copy. So if you want one, we can send them to you. Just let us know. All right. I think that's
yeah, fantastic. We click
us.
over to the next one. So, what is arthritis? So the word arthritis, as Tori said, is a bit of an umbrella term. There's a lot of conditions that sit under that word arthritis. It is a Latin word, and it comes in the meaning of it is sore joint. But there are so many different conditions. There's actually about 140 different conditions which sit under the word arthritis, which a lot of people are very amazed at. Like I say, I've worked at Arthritis New Zealand for 6 years, and I'm nowhere near close to being able to remember 140 and say a lot of them. A lot of them have really long names. The top ones there in Arthritis New Zealand are in bold. So, osteoarthritis is the most common form of arthritis in New Zealand, followed by rheumatoid arthritis, and then gout is actually the third most common form of arthritis, which is quite surprising. I think lots of people don't realize that gout is a form of arthritis. And you can see a list of other names there. So, ankylosing spondylitis, for example. It's very similar to osteoarthritis, but it's really concentrated in the spine. Reactive arthritis, we'll talk a little bit about that in the future, but that often happens after you have an accident or an injury. And then juvenile idiopathic arthritis there. So those are the children that I work with that have arthritis. And then, of course, there's lots of different autoimmune conditions that sit under the word arthritis as well. So think of your conditions, like Tori said, like fibromyalgia, which is a little bit on the line there, but we include it. Lupus is another example. If you want to click over, Tori. So there's more than 750,000 people in New Zealand affected by some form of arthritis. So quite a lot of us. I think it's safe to say that if you don't have arthritis yourself, you will know somebody, and probably some be quite close family or friends with somebody who does have arthritis. You can see the figures there. So about 57% of our population have osteo. Um, Gout, sorry, is actually the second, not the third. So gout has about 27%, and then rheumatoid arthritis about 16%. So we know arthritis does affect a lot of people.
I might
Clicking.
just see here. Who here? Can you put your hand up if you've got osteoarthritis? Can we see you in the Whitney's room? What about rheumatoid arthritis? Anyone got rheumatoid arthritis? And what about gout?
My husband has gout.
Yeah.
Yeah, I hear
There
that
you go,
quite a lot.
Joanne.
That my husband, my dad, my
Yeah.
uncle, yeah, the
Yeah.
men do get the short end with gout.
Thanks for sharing.
So osteoarthritis in Aotearoa. So we've talked about how it's the most common form of arthritis. It's more common in women as we get older, unfortunately. Sometimes, depending on the crowd that I'm presenting to, I make a little joke that I think women get more osteoarthritis because we do more work in our life on our joints, but I don't know if there's much scientific evidence to back that up. And we know that excessive weight or having low muscle strength will contribute to having osteoarthritis. So, if you weigh more, or if you have really low muscle tone, so maybe you've been inactive for a little while, the pressure on your joints is greater, and that can be a contributing factor to having osteoarthritis or having greater side effects from osteoarthritis. The next slide on here
I was
is
just, sorry, I was just going to say to add to that, if you've had an injury, so if you've had an injury like an ACL or a meniscus tear or a broken arm or something or an infection, there's a huge increase of getting osteoarthritis after that as well. So
There's a great picture here of a healthy joint and then a joint that's affected by osteoarthritis. So you can spot a few differences in this picture. One of the biggest differences that I think is shown here is the thinned cartilage. So between our joints, between every joint in our body, we have this really thick coating of this amazing substance called cartilage. Most of you guys, if you're preparing food, would have seen or felt it before. It's a really amazing, strong thing that our body makes. And when you have osteoarthritis, that cartilage thins right out. And because it becomes so thin, often the bones can rub together. You can also see quite a bit of swelling sometimes when you have osteoarthritis. It is not the same as having bones that are a little bit weaker or what's that condition called, Tori? It often gets confused with osteoarthritis, osteoporosis. So it's not the same as osteoporosis. Osteoarthritis definitely affects the joint and the cartilage and less of the bone. We go to the next slide. So, who gets osteoarthritis? So, we've talked about how women are twice as likely as men to get osteoarthritis. They don't really have a why of that, but I suspect, like a lot of arthritic conditions, women go through a lot of hormonal changes throughout their life, and they think that that could definitely be a contributing factor. We've talked about weight. So if you weigh more, you've got more pressure on your joint. And then, as Tori mentioned, so people who do hard, repetitive physical activity can be more susceptible as well. So where I live in Taranaki, there's a lot of farmers, a lot of really hard-working farmers, or people who are working in our primary industries, maybe in our factories. And they're doing a lot of that repetitive physical activity. So if you've ever seen anybody milk cows, they're constantly cupping. And if you think they do that 2 or 3 times a day, since they're 10 years old for 400 cows, that's a lot of repetitive action on your wrists. So I see a lot of farmers that have severe osteoarthritis in their wrists, in their fingers. Fencing is another one, working at fencing. But then, as Therese mentioned, our rugby players. So if you injure yourself or you tear an ACL or something like that, or you have quite a physical job, that can definitely contribute to having osteoarthritis as well. So, causes and risk factors. We know that osteo is hereditary, so we do see it being passed down in families. So often you'll have, great grandmother, grandmother, the mum, and then possibly the child with something like osteo. We can see that pattern, and mainly people over the age of 45. So we don't use the term wear and tear anymore, but the reason that saying was brought about was because the older you get, the more you use your joints, the more likely you are to have osteoarthritis. So if you're 65 and over, I have a greater population that do have osteoarthritis. And then having that past joint injury or infection. And that's why it's really important to make sure you rehabilitate correctly. So we want people to be out there playing sport, doing exercise, and doing things that they love. But if you do know somebody that's had an injury, doing that correct physiotherapy, building that muscle strength, and making sure your joint is as rehabilitated as possible can really help in the future when you get over the age of, that age of 45. So, what can osteo feel like? So, for those of you that have osteoarthritis, let me know if any of these feel familiar, but these are kind of like the top four that I hear from people. Really stiff joints. So when you have osteoarthritis, you can feel really stiff. They say it's stiffness that lasts 30 minutes after you get out of bed, for example. So I think most of us are quite stiff in the morning before we wake up and before we, stretch our bodies. But if you have stiff joints that are there for a really long time, that can be osteoarthritis. Painful and swollen joints. So when our body is experiencing pain, or we can feel that bone on bone or that cartilage is thinned, our body will often send fluid and heat to the region, and that will be that swelling that can happen with osteo. Muscle weakness. So I hear this one a lot that people say that they just feel like their legs are going to give way. So maybe when they stand up out of a chair, the muscle weakness in their knees, they can really feel it, or their hips, or grasping onto things becomes really challenging. And creaking or cracking in the joints. It's super common that you can get air, you can have gas build up with between joints. So that's really common and not always osteoarthritis. But if you do have osteoarthritis, sometimes you can hear that creaking or cracking of the joint. And again, that's just down to that really thin cartilage. If you imagine cartilage as being a pillow, the pillow has become very thin, and so yeah, it's not providing that comfort anymore. So sometimes you can hear the creaking and the cracking of your joints. So how is osteoarthritis diagnosed? It's a really good question, and it really varies depending on what healthcare you're receiving. As Tori has said, the reason we have our Arthritis Assist team is because we really find that people will often go to the doctors. They'll have their 15-minute appointment, and they'll be diagnosed really fast with osteoarthritis. Some doctors will just say, yep, you have arthritis and on your way. Some doctors are fantastic and provide more of a wraparound support and explanation. But osteoarthritis is one of those things that a GP will often examine the affected area. So if it's swollen or painful, often they will examine that part. Sometimes they will order x-rays or MRIs, but I have seen less of this recently because osteo doesn't always show up in an x-ray. So you can have really high levels of pain. You can be experiencing all of the symptoms of osteoarthritis, and it can be really affecting your daily life. You can go and get an x-ray, and sometimes the osteo won't show up in that x-ray at all. And likewise, you can maybe have an x-ray for a completely unrelated reason, and there'll be really visible osteoarthritis in that x-ray. So again, they don't really know why that happens or what causes that. So I'm finding more and more in the community that doctors won't do an x-ray. But it is something they can do, and often can be part of some people's diagnosis journey. So this is what we're all here for. So how can you manage your osteoarthritis? So there's so many techniques and ways that you can live well with having any arthritis and having osteoarthritis. These are some of my top ones that I think are really valuable that I hear people get some really good results out of. Exercise and movement. And we used to just have exercise there, and I'm glad we've added the word movement, because when I hear exercise, sometimes I feel a bit overwhelmed and I feel a bit like, oh, but I can't run, I can't jump, I can't swim. But it's really about increasing your movement and increasing that muscle tone. So that will look different for everybody, but staying active, keeping moving, stretching. I'm a big advocate of sending people that are really struggling to something like their local aquatic centre. It's often really affordable to go. You can do some water walking. It lifts your body weight up, so there's no pressure or very little pressure on your joints as opposed to something like walking. And then I always treat myself to a spa afterwards, so it's always a win-win, really. But yeah, building that muscle strength is a really good way to manage osteoarthritis. If you imagine your joints are together like this and there's not much cartilage left, that can cause quite a bit of pain. you can improve that by increasing the muscle tone. So if this is your knee and then you are putting lots of effort into building that muscle tone around, that muscle tone will automatically support those joints and pull those joints apart, which will give you lots and lots of yeah, hopefully lots of comfort. Pacing. So has anybody heard of the term pacing before? Show of hands if you have. I know you would have, Tori. So pacing. So when we talk about pacing, we talk about the pain cycle a little bit and the cycle of maybe doing too much. Gardening is a really good example. So particularly this weather we've been having recently, when it's a nice sunny day, you want to get out there and you want to, do all this work in your garden, and often it's quite physical, and gardening's really enjoyable for a lot of people. So you can get lost in time and you can be out there for 4, 6 hours before you know it. The term pacing is still doing those things that you love, whether that's gardening, knitting, walking, riding your bike, but making sure that the next day you can continue to do it. So we don't want to do so much in one day that then the next day, or maybe the next week, maybe the next fortnight, we're experiencing really high levels of pain because of that activity. We want to do that activity in smaller amounts, maybe take breaks. So for gardening, for example, I would say, if you can easily get lost in the garden for 4 hours, maybe do 45 minutes and then get up, do some stretching, do some movement and exercise, have a cup of coffee or a tea, and then maybe do another 45 minutes. And then hopefully by pacing yourself, it means you can enjoy those activities each day. And build up your stamina. And you can apply that to anything. So gardening is a great example, but I do this with work. I do this with my children's sport, for example. You can apply pacing to lots of different things in your life. Another way to manage osteoarthritis is medications. So, if you are experiencing a lot of issues with osteo and have some high pain levels, taking medications is often a really good way to manage. So, really common medications are your paracetamol, anti-inflammatory, ibuprofen, and then topical creams. So, a Voltaren is probably the most common one, the brand name Voltaren. But a lot of those creams are really good at soothing the muscles and the joints and can be really beneficial. To do before something like bed or before you start your day. You can go to the next level of medications and you can look at talking to your primary health care provider around things like steroid injections. Often steroid injections are given directly into the affected joint. And it's just like anything. Some people can see really amazing results and instantly feel much better. Some people it may not be as effective on. The thing with steroids is the more you take them, quite often the less they'll work. So steroid injections are something a doctor would do maybe once a year, twice a year. So yeah, you don't want to get into the habit of wanting or needing a steroid injection really frequently. And then heat and cold. So again, we're in New Zealand, and I feel like it used to be, heat in the summer and cold in the winter, but now I feel like it's day to day with this weather. So using heat and cold to your advantage. So you can have things like hotties if you enjoy that heat and that gives some relief. Things like sparkles are really good as well. And then equally cold. So having a cold compress on a really hot day can really help your joint as well. And I'll just run quickly through these ones as well. So, relaxation techniques and things like Tai Chi or meditation or yoga can be really beneficial for people. Eating healthy. So, what we put in our bodies, we know what we put in our bodies has an effect on how we feel and how we act and how we repair ourselves. So, eating those really good foods is really beneficial. Joint protection. Um, I always say to people before you go and spend money at a physiotherapist or a health store, get some good shoes. Often shoes are overlooked. Having a really good pair of shoes can make a real big difference. A pair of shoes that are really supportive, and using aids like walkers and walking sticks when you are having a flare up can be beneficial too. And then lastly, surgery. So some people who have osteoarthritis will go through down the surgical route and look at having a joint replacement, whether that's a knee, a hip, or a shoulder. So again, your primary healthcare provider will talk you through kind of that process. Now in New Zealand, it is often quite a long process. So even if you are going to have surgery, doing all of these other things to get surgery fit, so relaxing well, pacing yourself, protecting your joints is a really good way to go before surgery. Yeah. So we'll move on to gout. So I just wanted to lightly touch on gout and arthritis. It's quite a unique arthritic condition. It affects a lot of people, and a lot of people don't realize that it is a type of arthritis. So it's actually the most second form of it's the most second most common form of arthritis in New Zealand. And Māori and Pacific people have genes that cause gout. So they used to be referred to as a super gene. Because of course back in the voyaging days they were super beneficial to be able to hold on to that uric acid. Nowadays, with the introduction of the Western world, they're not as useful, and so that's why we see higher numbers of Māori and Pacific people with gout arthritis. And men, you are more likely to get gout than women. So men are 3 times more likely to get gout than women. So I work with a lot of young males here in Taranaki, and quite young too. I think the youngest person I've ever worked with was about 18, 19, and he had gout arthritis unmedicated for quite some time. So it really can affect men, from quite a young age as well. So, what is gout? So, gout is caused by high uric acid levels in your blood. We all have uric acid within our blood. It's a compound within our blood that makes up our blood. And usually, when we go to the toilet, when we go to the wharipaku, we will excrete uric acid every time. But when you are having gout or having gout flares, you hold on to the uric acid. So you have too much uric acid within your body and it has nowhere to go. So what it does is then it goes to often a cold joint. So fingers, toes are really common, and it'll form these tiny microscopic crystals. The crystals will sit in the joint, and it is very, very, very painful. I have met people that say when they're having a gout attack, they're bedridden, they can't walk, they can barely have the window open for a breeze on that foot. It is really painful for a short amount of time. A gout attack usually lasts 5 to 7 days. And then just as fast as it goes on, that uric acid will dissipate and it'll be gone again. There is a big myth around gout that gout is caused by what you eat. So often people feel that it's quite a self-inflicting condition, and that's not a great place to be mentally. So a big part of my role and Arthritis New Zealand's role is getting the message out there that only 10% of the high uric acid in your body is caused by what you eat and drink. So you may have foods that if you eat, if I know I eat that food, I will have a gout attack. But 90% of the high uric acid within my body is caused by my genetic makeup, my kidneys not working 100%, or maybe having that excess weight. So it's really important to have the message out there that you can eat really, really well, but if you are experiencing high uric acid levels and gout, you do need to go on a preventative medication which lowers that uric acid overall. I think the next slide is basically just explaining that. So New Zealand has the highest rate of gout in the world. Partly probably due to our high numbers of Māori and Pacific people that reside here, but also because I think we do lack education in that space. We really think that if you have gout, it's because of what you ate and it must be your fault. And because of that, lots of people don't seek help. They don't go on preventative medication and they don't understand the condition. So yeah, that's a really big part of my role is pushing that message out there. So, who gets gout? Your genetic makeup. So, about 60% of people that have gout have it because it's within their genes. And we see it within families too. So, much like osteoarthritis, it's a very hereditary condition. Increasing age. So as people do get older, um, you may have kidney conditions, or your kidneys might just not be working at 100%. And if your kidneys are not at 100%, they may not be able to process that uric acid as they once did, which can cause high levels of uric acid, in turn then causing gout. And who gets gout? So we know males do, we know being overweight again, and taking certain medications. So some people will have to take medications for other reasons, for other conditions, and that can affect their kidneys producing, or their kidneys working 100%. So sometimes you may have to take uric acid lowering medication alongside other medication as well. And so we've talked about that a little bit. And if anybody wants to know anything more about gout, we're doing a lot of work in this space at the moment. So we've got lots of great resources and doing some great work. I think there's actually a couple of Pacifica events happening at the end of this month where our colleagues are going up to Auckland. So that'll be fantastic. So yeah, if you are interested to learn more about gout and how you can help, or if you have somebody in your family, yeah, we're more than welcome to talk about that more. So how is gout diagnosed? So again, it's a little bit different to other forms of arthritis. It's actually diagnosed by a very small blood test, very similar to the test you have when you have diabetes. So often they'll do a finger prick test. They can include it in part of your normal blood testing if you request that. But normally, if a doctor suspects you have high uric acid, they'll do that finger prick test. I think last expo we went to, Tori was actually on duty of doing the uric acid testing. So it's super easy to do. It's super fast, and it gives you your results. And basically, there's a level of uric acid we should have in our blood, and if you're over that, then you're at risk of having gout. In extreme cases, people may have fluid taken from the joint, and then that fluid can be tested. And sometimes health professionals can do X-rays as well, and you can visibly see gout within an X-ray. So, how do people manage their gout? So, I talked a little bit about those long-term uric acid lowering medications. So, the most common one in New Zealand is called allopurinol. You may have heard of that word before. You may be taking allopurinol. It's a medication you have to take daily. So, it's a super safe medication. It's been tested for many, many years. And you take it once a day, and it lowers your uric acid, which then means you should be really living well with gout and not having any flares. Maintaining a healthy weight, so our kidneys can work good and we can keep flushing out that uric acid. And eating a healthy diet definitely contributes to managing gout. Okay, I am speeding through because I'm just conscious of time, but well, I don't have to run anywhere at 11. So if you guys are all okay, we've just got a few more slides on rheumatoid arthritis, and then we'll open up to any questions that anyone has. So rheumatoid arthritis, often people will shorten the condition rheumatoid arthritis to RA. So you may hear people say, I have RA, or you have RA. So what they're meaning for that is rheumatoid arthritis. It's the third most common form of arthritis in New Zealand, and women are 2 to 3 times more likely to get RA than men. And the most common age for diagnosis for rheumatoid is between 25 and 50, which again is a little bit different to something like osteoarthritis. So women are actually relatively young when they're diagnosed with rheumatoid. You can see there's a healthy joint and then a joint that's affected by rheumatoid arthritis. So if you remember the osteoarthritis joint, we were really looking at that cartilage. In rheumatoid arthritis, the cartilage there looks fine. It looks very similar to a healthy joint, but what you can see is that swollen, inflamed section in between the two joints. So that's often what will happen in rheumatoid is people will have a lot of swelling. It's also symmetrical, often rheumatoid arthritis. So people, if they have it in one hand, will often develop it in the next. Same with shoulders, knees. It's quite symmetrical on how it identifies in the body. Rheumatoid arthritis is actually an autoimmune condition. So it means Autoimmune conditions are a little bit different to osteoarthritis, and they're really about the cells in your body attacking themselves and attacking each other, and that's what an autoimmune condition is. 126,000 New Zealanders are affected by RA, so that's about 3% of the population. So quite a lot of people have rheumatoid arthritis. And I've been waiting for years for the answer to this, and they still don't know. Lots of people are doing lots of research, but smoking is a really big risk factor and cause for rheumatoid arthritis. So if you are diagnosed with rheumatoid or you know somebody, the first thing a health professional will do will advise you to try and stop smoking or lower the amount that you are smoking. Who gets rheumatoid arthritis? So again, unfortunately, it's often genetic. So we see it in families. Infections, which is quite an interesting one. So often people will be diagnosed with rheumatoid arthritis or have a flare of their first flare of rheumatoid arthritis after having an infection. So that can be something like the flu, or something maybe a little bit more serious. But yeah, often we find that people will have infections that may trigger the rheumatoid in their bodies. And then hormones as well. So this probably answers why more women get rheumatoid than men, is when we go through that hormone changes through childbirth and through things like menopause, rheumatoid arthritis can be triggered as well. And so, how is it diagnosed? So, unlike osteoarthritis, rheumatoid arthritis is diagnosed via blood tests. You either have the markers and you have rheumatoid, or you don't. So, if you do have rheumatoid arthritis or you suspect you have it, going to the doctors, getting referred to a rheumatologist, and getting blood tests done will be a really definite way to find out if you do have rheumatoid. Osteoarthritis is a bit more, oh, you have a little bit, you have a lot, it can vary. Rheumatoid is much more definite. So via a blood test, x-rays again, and physical examination is often what your primary care professional will do. And how can you manage rheumatoid arthritis? So much more of a medication clinical pathways with rheumatoid. So the idea is that you get onto disease-modifying medications to slow down the progression of rheumatoid arthritis. So some of you may remember 50, 100 years ago, great-great-grandparents, you'd remember them having rheumatoid arthritis, and the effects on them would be really great. And that's because they didn't have the medications that we have now. So now we have some really amazing medications that, hopefully a lot of people can go on and live really well with rheumatoid arthritis and slow down the progression of that disease. It's really important to get diagnosed early. So if you have, if grandma had rheumatoid arthritis, you have it, and you have maybe a granddaughter who's experiencing symptoms, it's really important to encourage going through that process, because the earlier it's diagnosed, the better. So there's non-steroid anti-inflammatory drugs. Those are kind of your over-the-counter, your ibuprofens, diclofenac, your anti-inflammatories. And then you have DMARDs, which are disease-modifying anti-rheumatic drugs. They're the ones that can really slow down that process, progression of the disease. Steroids reduce inflammation, so they're often used. And then biologic therapy. So biologics, explained simply, biologics are medications that are made up of living matter. And so because your immune system is attacking itself, biological therapies are medications that you take to try and stop or slow down that process. Fantastic. Okay, does anyone have any questions? We'll open up the floor. No question's a silly question. We'll try our best to answer. And if we can't answer, we will definitely find out the answer for you and, get back to you.
I ask a question, please?
Yeah, go, Brian.
Simple one. The arthritis, I've got osteoarthritis. I've had both hips replaced. Yeah. I've got gout as well. And they told me it was all due to walking on concrete. Is that right or no?
Yes.
Well, I think I don't know your case personally. I think walking is an amazing exercise. It is really low impact on the joint. Um, I wouldn't say it's because of that. I would say possibly the walking and maintaining your muscle strength is a real positive. And hopefully, since your joint replacements, have you seen some positive changes? Are you still able to walk? Are
Uh,
you
I've had both hips replaced, and both of them, well, one was in 2006 and one was in 2010. And boy, the difference afterwards was
yeah.
phenomenal. I can now walk a lot easier. I'm being told I must carry a walking stick, which I do.
Yeah.
But it's brilliant, the two operations.
Yeah.
And the gout one I had in about um 1998, and they all laughed at me. They said, "You're drinking too much wine, Brian." So,
See? Yeah, well, that's fantastic that you had such good results. I think don't let it discourage you from walking. I think I always
no,
say, walking on concrete is, a hard surface. So if you can, if there's grass next to it and you're stable, maybe go to the grass. I walk on the beach, but I really
yeah.
don't think it would make that much difference, that much impact. Walking is,
Walking on concrete was to do with my work. I used to work in the building industry, and of
yeah.
course, you were always on concrete.
Yeah. So probably more, I would say, I mean, it doesn't cause you osteo, but I would say you fall into that category of a really hard, repetitive physical job you would have done for many years. So,
Mm,
yeah,
mm,
yeah.
mm.
And so do you take daily medication for your gout now? Do you take allopurinol
Oh, I
day?
get blister packs, and I take.
Brilliant.
Don't ask me what they are. I get 6 pills in the morning and 4 pills for my dinner, and the doctor gives them to me, and that's it. I just take them and say thank
Brilliant.
you very much. I
There
think
you
there's
go.
two
Perfect
paracetamol in
student.
each one, and I got a tramadol in one in the evening as well. So
Yeah, fantastic. Awesome.
About supplements.
thank you.
What was that? Sorry, was there a question?
Do you recommend any supplements for people with arthritis?
We do. We don't recommend anything in specifics, because I think it's too hard to narrow down to one thing that fits everybody. Everybody's different. I think when you're looking at living well, there's always things personally. Me, for example, I don't eat a lot of red meat, so I
Hmm.
supplement that by taking iron tablets. So I think supplements can really help. But it's really about finding what you're lacking, and often it's a bit of trial and error. I always say to people, don't invest a lot of money, but the people that do work at kind of health stores, if you have places like Healtheries, for example, they're full of so much knowledge. And so if you go in and say, this is kind of what my diet looks like, this is what I'm experiencing, I'm sure they'll be able to give you some suggestions on supplements that you can take that do help. Tori, do you know much? I know we did have a thing recently about omega 3s with rheumatoid arthritis. Oh, you just
Hi, hello. Supplements themselves, I think it's like exactly what Georgie was saying around trying something, seeing if it works. If you were thinking, oh, actually my joints are a bit sore, I might start on some fish oil or some omegas. That they can really help you. But I do know, I can't remember about the fish oil and rheumatoid arthritis, but it is a really good, it's like a lubrication in your joints. Um, However, I'm really hesitant about there are so many different supplements. I would try them if you wanted for a good month and then go off them and see if you notice a difference.
Mm.
Um, and we've got some really nice information around supplements and different vitamins on our website, written by a nutritionist. I think they've looked because it's all around evidence based. And what happens is they start doing all the research, but then it fizzles out. So but with diets, for instance, the most researched diet would be the Mediterranean diet, which is and they've done loads of research on that, and they do say it's one of the most healthiest diets you can live by.
Yeah.
Can I say one thing about fish oil, please?
Yeah.
Brian?
I tried it once. It has some side effects. You tend to smell of fish oil, and it's not good.
Yeah.
So I stopped that one.
Yeah, and that's it. It often comes down to just trial and error, right? Sometimes you can find something that really works and it's worth taking. It's worth a bit of a fishy burp here and there, or there's some things that just don't work for you. So it is a hard one to pinpoint. Does anyone else have any other questions?
I've got a question.
Yeah.
What is you showed the images of the difference with osteoarthritis and rheumatoid. What's the the symptoms difference? Say, you're getting joint pain in your hand or something like that. Is there a way to kind of you obviously go and get diagnosed and whatever, but is it a way to kind of identify?
Yeah, so rheumatoid arthritis, because it's an autoimmune condition, it does show up in your blood test. And I say that very plainly. The way they can tell it in a blood test is they look at your inflammatory markers. And if you have certain inflammatory markers over a point, that's when they diagnose rheumatoid arthritis. Whereas in osteoarthritis, you can have high inflammation, but they're different inflammation markers. So if you are experiencing a sore joint, and that's why it's really important to not just say, oh, I have osteoarthritis, the doctor won't do anything. And it is important to go through to your primary health care and get that blood test done, because it may be the fact that you have osteoarthritis and you just, need to live well and manage pain and do some physical activity to build that muscle strength. Or you'll do that blood test and it'll show inflammatory markers, and you actually fall into the category of having an autoimmune condition like rheumatoid arthritis. And at that point, you would then get referred on to a rheumatologist, a specialist. I think I'm right in saying that, Tori, that so if you have osteoarthritis and you're not going into orthopedics for surgery, you don't go through to a rheumatologist anymore, right?
No, you don't. No,
Yeah.
you don't. So also just with the differences between these two conditions. So with osteoarthritis, if the pain goes within 30 minutes, that's usually osteoarthritis. But with RA and inflammatory conditions, if the pain continues after 30 minutes, then there might be something else going on. With inflammatory blood testing, it's if you're a bit run down, then your inflammation levels are going to be raised as well. So it's always good just to take a bit of a journal if you think, oh, there's something else going on. Because remember, you're the expert of your body. So you know when something's not going right. So just sometimes it's if you think something's not going right and something's feeling bad in anything actually, I'd journal it. I'd write a bit of a journal and then go, well, because usually what happens is you finally go to the doctor and you're fine. Because it's quite nice to actually just go, well, this is what's been happening over the last month. And then they can start problem solving. They say with inflammatory conditions and rheumatology conditions, it's probably the most modern of all the specialist services, because we're still finding out how it works, what happens. And even the rheumatologists don't know. And that's why there's all these different medications that you go on, is because it's a little bit like trial and error. Okay, that doesn't work. We're going to try you on this now, and then we'll see if that works. But definitely the pain test of the 30 minutes, because usually once you start moving, you're up, moving, that pain dissipates with osteo. But with inflammatory arthritis, it continues. Does that answer it?
Osteo in both knees, for many years at least been treated, but for the last 2 weeks,
I've been having, it's almost like an infection in my legs from my knees down into my feet, and my feet burn, absolutely burn with pain.
Oh.
What can I do for that?
So is this in your knees? It starts in your knees. Is that right?
Yes.
Yeah, and then it goes down into your legs and into your feet.
Like a bad circulation,
It
maybe?
it could be nerve pain as well. It could be it could be I would once again go back to your GP and just say this has been happening for the last, is it 2 weeks, you said?
Yeah.
2 weeks. Try some, topical. You could try some, because everything's connected in our body as well. Start trying to, maybe even just starting some compression, putting a bit of compression around your knees to get the blood flowing. Using rub your knees and your legs and your feet if you can get down there, give them a good massage. Using, like we said earlier, around heat and cold, use a bit of, if they're swollen, use a bit of ice, but some frozen peas, but not for too long because then your natural, um, what's it called? Oh gosh, it's gone. What does, when your body makes, it's the anti-inflammatory, the natural anti-inflammatories go down. Um, Yeah, that's interesting though. So they're really, really aching. Are they hot? Are they hot to touch?
Yes.
Yeah, hot to touch.
Do you use compression at all? Have you ever used compression socks?
You use compression socks?
No.
Yeah, I mean, I think you definitely should follow up with your doctor, but something like compression can really help with that. I mean, if it's hot, to me, it sounds like, there's a bit of inflammation there, and that's often how it can feel quite like burny. So yeah, I would go see your GP first and foremost and get things checked out, but then investing in something like compression socks. You can buy compression wear, so socks and gloves at like local disability centres, but the warehouse actually brought out a range last year of adaptive gear, and I've heard really good things about them. So it could be a good way to buy where the warehouse ones, they're much cheaper. They're only about $15 a pair, just to see if it works before you invest in invest in kind of more of a higher brand pair. Yeah.
They might prescribe you anti-inflammatories if there is an inflammation. So, yeah, definitely go to your GP or even your pharmacist. Remember, pharmacists are awesome. They are the people that make all the drugs and they know all the side effects, and especially your community pharmacist if you use a community pharmacist, and they usually don't cost anything. So always if and sometimes if they're not that busy, you could go and ask them about it as well, and they might have some advice for you.
Does anyone else have questions? No? No, I think that's all. Thank you, Georgie and Tori.
No, you're welcome. Thank you, guys. And I think our hybrid event went quite well. There was no major technical difficulties.